How are you? Via Eastern Kansas, coming to you live from our Leavenworth Medical Center, and just want to spend a couple minutes giving you another brief update about our COVID-19 vaccine, where we've come from and where we're headed. So again, thank you for joining us. I'm Joseph Burks. I'm Chief of Communications here at VA Eastern Kansas. So as of today, we've had an incredible week. This week alone, at VA Eastern Kansas, we've actually provided 2,800 doses of vaccine. So currently, our totals are as follows. We're about 6,400 in our first dose, and we're about 2,400 of the second dose. And that also includes about 1,600 plus employees who most are through their second dose already. So we're moving along very, very well. And again, this week has been an incredible week. The hallways have been filled. And saying that, we have guidance and information that are in our hallways. We want to continue to be safe. So social distancing is important for us. We need you to continue to wear your mask. We need you to pay attention to our entry guidance. So if you keep doing that, we're all going to do just fine getting through this. Now, I want to update you. Last Friday, I talked about we had a plan for moving off site on the Leavenworth side of our healthcare system. I need to correct that now, okay? So we looked at it earlier this week, and there were some logistical things that we aren't able to work through just yet. So we will not be, I say it again, we will not be providing vaccines at the Church of the Open Door, who we have partnered with. It doesn't mean we may not go there in the future, or we may not go somewhere else in the future, but some of you've received some information. I need you to know right now that every one of your vaccines, until you hear from us further notice, those vaccines will be given right here at the Leavenworth VA Medical Center for those who had their first shot scheduled at the Leavenworth VA Medical Center. So again, we'll continue to put more information out with that, and you should be getting some phone calls as well. So pay attention to that, and we'll continue mission. So Topeka, those on that side, and I will share this live video with the Topeka side when we're done here in Leavenworth, but the Topeka side is going to the rec hall, building 24, fairly soon. Our engineering team and logistics team is standing up what that clinic looks like, and it'll be a lot more space and a lot more opportunity for us to get around safely. We're doing a great job in the chapel right now, and again, they knocked out nearly 1,500 doses this week. So hats off to the entire crew that's doing that, and hats off to you too, veterans, for coming in here with a smile and being patient in what we're doing. When I say that, patience is going to have to be the number one trait that we all share until this COVID vaccine process is completely done. And I say that we're getting a lot of compliments and some emails, even right here on social media. You all are coming back with some real positive comments about the process and how it's going. It's not perfect, and we know that. And so my number one request to you, please, if you hear nothing else from this, my number one request to you is be on time. I know we as veterans, I'm one of them too, we always wanted to hurry up and get there, right? We wanted to be the first in line. We needed to be there before the first sergeant got there. So I am telling you right now, you cannot be early, and I don't want you to be late, all right? But if you're there an hour early, you're there an hour and a half early, you're going to have to wait until that appointment time. This is so fine-tuned with what we're doing. We're scheduling 10 every 15 minutes. So if you're there on time, you're going to be there with about 10 other people. You're going to move through that process, and you'll be followed up with the next 10. So if we have 40 people in our hallways at 8 a.m. in the morning, that's not working out well for us. And it's also putting us at risk, okay? The vaccine is going to help take care of some of this, but also the actual virus. Nobody has said that that's gone yet. So work with us on that. Continue to be patient. Show up on time, all right? We appreciate that very much. And we talked last week a little bit about caregiver support. No changes there, right? So only the primary or secondary family caregivers enrolled in our program, and that program is called the Program of Comprehensive Assistance for Family Caregivers. If you're enrolled in that program, then yes, you are eligible to receive that vaccine when we call your veterans. So just be prepared for that call. I believe our team sent out some letters this week as well, so you should be getting some information in the mail about that as well and what that process looks like, all right? Again, thanks for your patience with that, and we've again already had some positive feedback with some of our family caregivers that are out there and have already had their vaccine as well. If you need to know more about the caregiver program, I need you to go to www.caregiver.va.gov or get in touch with our caregiver team right here at VA Eastern Kansas, and that phone number is 785-350-4507. All right, so that's a little bit of update about caregiver support. Again, we're going to slowly transition to a larger site on our Topeka campus. We're going to stay in place at our Leavenworth VA Medical Center for the time being. Need you to be patient, be on time, and follow us. All right, we're going to give a lot of information out right here through our social media site. We're also on GovDelivery, which I put on our chat room last week, and I will do that again today when we're done. I'm going to put on how you can sign up for the public email platform called GovDelivery. All right, postcard campaigns. I'm going to guess by now almost every one of you veterans should have received by now a postcard talking about the robocall process. The robocall process is still in place. You'll get a call. You'll select option 1, 2, or 3. 1 saying you want it, 2 saying you don't, 3 saying I'm not sure, all right? And so if you hit 1, be patient. 10, 11, 12, maybe 14 days. You can't be exactly sure on that yet, but be patient with that, because once you press 1, someone will reach back out to you and get you scheduled for that vaccine. And we are looking at some other options moving forward, some other text platforms, the vet text process that we have in place for some other appointment. We're looking at that to see if there are possible ways for us to improve appointment scheduling for the vaccine as we move forward. But we're not there yet, so still expect that robocall, okay? Again, if you want to follow us, come to our social media site, Leavenworth VA, Topeka VA. We're on both sides of the healthcare system. We've got some plans out in our CBOC areas, our larger CBOC, St. Joseph and Junction City. Stay tuned for more information in the next couple of weeks about setting up COVID clinics a little bit closer to where you're at. Again, more information coming, so follow us here. And like always, you can go to our websites. This information, along with the step-by-step process of what the robocall looks like, and also what the estimate age risk group stratification looks like, so you can kind of have an idea over the next several months where you might fit in as a veteran based on your age and your risk factors. Okay, so go to topeka.va.gov, or on the Leavenworth side, you got leavenworth.va.gov. Put a www in front of those and you will find us there. You go into local features, or later on this week you'll be able to go to its very own COVID link underneath A to Z services. So can't thank you enough for seeing what you're doing with this vaccine process, and even more, healthcare hasn't stopped. You guys are still coming in. You're getting the care that you need. You're getting the care that you've earned. You're getting the care that you deserved. And if you ever have any questions about how do I get enrolled in VA healthcare, reach out to us. You can do that through our social media site. You can send an email to our websites out there, and you can also get in touch with us direct through our eligibility office. So again, can't thank you enough. I'm going to tell you, go out there, have a great weekend. Tomorrow, and let me check for one more message here, and we're looking at tomorrow, okay, pay attention. This just came in, and I will post this later as well, all right? So we have 100 extra doses that we must get rid of tomorrow. So on the Leavenworth side, we already have some scheduled appointments. On the Leavenworth side only, I have 100 doses, and that will be for 65 and older. All right, so tomorrow, if you're not scheduled, we will take the first 100 walk-ins, and they're first come, first serve. And so I would tell you, anytime after 10, slide on in here if you're 65 and older and you're an enrolled veteran. Get in here and let's get rid of those other 100 doses tomorrow. All right. Again, if you have any questions, throw those in the chat box, and we'll try to get those answered later on tonight. If not, have an awesome weekend. Happy Valentine's Day, and know that we love you, veterans. Thank you.